Hi, I'm Nadina LaSpina, and I will be talking to you today as a single-payer advocate. I have been one since the very early 90s, and as a senior citizen. I've been a senior for a good number of years, but primarily as a disability rights activist. I've been a disability rights activist since the early 70s. This week we've been celebrating the 54th anniversary of Medicare and Medicaid. These two government programs have saved many lives, continue to do so by providing health care to seniors, people with disabilities, and low-income people. I should give you some numbers. 75 million rely on Medicaid, 57 on Medicare, and here in New York, 3.5 million are on Medicare, and 6.5 million on Medicaid, and 10 million low-income people qualify for both. Two things I want to mention to single-payer advocates. And I'm assuming that those listening to me are single-payer advocates since I'm doing this for PNHP. For those who say when we talk about a single-payer system, I don't want the government in charge of healthcare, well, Medicare and Medicaid are government programs, and sometimes the people who say that are on Medicare. The other thing for those who say going to a single-payer system would be disruptive, it has to be done gradually, start with a public option. In 1965, it was done 1, 2, 3. People got their card, started using it, and that was it. And now, having said those good things, I'm going to start talking about what's not so good about those programs. I don't know if single-payer advocates are still saying about Medicare, if it's good enough for grandma, it's good enough for me. I don't use that argument because Medicare is not that great for grandma, and they tell me that. And I'm also careful never to say Medicare for all. I say improved, expanded Medicare for all. First of all, deductibles and copays are so high that you need to buy supplementary insurance, so you still have to depend on private insurance. And if you get an Advantage plan, many opt for a plan that does not charge a premium, then your choice of providers is limited. You may get silver sneakers so you can go to the gym, but if you get really sick, you may not be able to see the doctor who could save your life, but because that doctor is not in the network, which is the same problem for younger people covered by HMOs. The other thing is that Medicare does not cover long-term care, and that's what I'm going to talk about mainly. In the disability community, the term used is long-term services and supports. So I may alternate using both. And what is long-term care? I like to say that it's the kind of care you need if you don't recover and if you don't die. It really includes a variety of services like nursing homes and home care, or again, what in the disability community we call home and community-based services and supports. Now, regular private health insurance does not cover long-term care either. So those people who say, I love my private health insurance, should be made aware of that. There is private long-term care insurance, but it is very expensive. And it's also quite limited. I know people who paid for years into private long-term care insurance. They got to the point when they started needing that type of assistance, and after all the paperwork, they were so happy that to get the services, congratulated themselves for having the foresight, being such responsible citizens, and then after 3 years, or maybe 4, depending on how high their premium was, they were told, that's it. You reached the limit, we're not going to pay anymore, you weren't supposed to live so long. So, the only program that covers long-term care is Medicaid. But Medicaid is a means-tested program. In other words, to be eligible, you have to show you're poor. So what happens to grandma and grandpa when they start needing help getting from the bed to the bathroom or getting dressed, when they start falling in the shower, or when they become forgetful? Please, I'm starting to forget things myself. They're supposed to pay for the care out of pocket. If they impoverish themselves, so they will then qualify for Medicaid. Those who can afford an elder law lawyer may retain one and have the lawyer figure out how they can legally make their money and assets disappear by transferring it or putting it in trusts, etc. What does that mean? It means that those who are too rich to qualify for Medicaid but not rich enough to be able to afford a good lawyer are the ones who fall between the tracks, who are in trouble. They're the ones who suffer the most. I know seniors who have taken extreme measures like divorcing a spouse in order to qualify for Medicaid. I hear from seniors who transfer their money to their children and complain their children are not buying them the things they want. Let's talk now about disabled people. People who become disabled as adults, usually they have worked, so they apply for Social Security disability. They may get rejected and have to reapply. Finally, they get their Social Security disability, yay! They have to wait 2 years before they can get Medicare. Hopefully, their employer insurance will continue to cover them, but maybe not, which means they could be in real trouble. And finally, after 2 years, they get Medicare, and now they have a mate, right? Well, unless their disability is such that they need help with activities, what we call activities of daily living, like, walking, getting in and out of bed, and all of that. Long-term services and supports, that's what we call them in the disability community. Then they will have to impoverish themselves and qualify for Medicaid. And that was my husband's story. He was 40 years old when he was diagnosed with primary progressive multiple sclerosis. He had been working for 20 years in the film industry as a set decorator. He earned a very high income. He had the best private insurance money could buy. When he got Social Security disability, his insurance kept paying until he got Medicare, at which point it became secondary to Medicare. So he didn't need to buy supplementary insurance. He thought, as bad as the situation seemed at the moment, with the multiple sclerosis progressing rapidly, at first it was progressing quite rapidly, at least he didn't have to worry because he was well covered under Medicare and private insurance. Until he couldn't get himself in and out of bed anymore, needed help in the bathroom, etc., etc. He found out that he was not covered for that kind of assistance. Lucky for him, his wife had divorced him, taken the house, and by the way, that's common when somebody becomes divorced. When somebody becomes disabled, often a spouse may walk out on them. So his wife had divorced, had taken the house, and the Social Security check was going to alimony and child support. So he was poor enough to qualify for Medicaid. And that was about the time he and I met. He joined the disability rights movement. He fell in love with me, I fell in love with him, and for 20 years we lived together. We loved each other as deeply as two people can love one another. But we did not get married. If we had married, my income and assets would have made him ineligible for Medicaid. You see, though I am obviously disabled, I don't know if you can't see, but I'm using a wheelchair here. That's how I get around. Even though I am disabled, I can attend to my own personal care. Until now, actually, I can do it, though with increasing difficulty as I get older. Because I didn't need a Medicaid, I worked. I taught Italian, and later I taught disability studies. I saved some money for retirement. I bought a little apartment, all those things good Americans are supposed to do. If I had needed that kind of assistance, the kind of assistance that my husband needed, I probably would not have worked. Or if I had worked, I would have had to limit my income. This is the situation for many disabled people. Because of their need for care, they have to take, I say, you take a vow of poverty for the rest of your life because you have a disability. Only in 2013 did my husband and I get married. What changed then? He had become more and more angry about having to show he was poor, since he didn't have to pay child support anymore because his children were grown. So his income was too high, even though his income was Social Security and pension, but it was too high, so surplus income had to go into a pool trust, and he hated that. Also, his MS had progressed to the point where he qualified for the limited Medicare home health program. He was in need of skilled services. In fact, at that point, he was already using a ventilator. He was having trouble breathing. He was considered also homebound. Now, those two conditions, if you are homebound and in need of skilled services, make you eligible for the Medicare program, which is really, the way I see it, it's meant for those who aren't supposed to live too long, because if you're at that point where you're homebound and you need all these services, skilled services, medical services, they figure you're not going to live so long. Well, my husband fooled them, and by living another 6 years. He passed away a little over 4 months ago. Well, the number of hours available under the Medicare program is very low compared to the Medicaid program, which in New York State, by the way, Medicaid is quite generous. So we had to pay out of pocket for the additional hours. And we used up most of our savings. But I decided, what the hell, if we run out of money, we'll both go on Medicaid. So yeah, my husband passed away. I don't know if I'm allowed to do this, but I'm gonna show a book that I wrote, was just published. It's called Such a Pretty Girl, a story of struggle, empowerment, and disability pride. And you can find it in major bookstores and online, and from the publishers, from NYU Press, who's the distributor. I'm just showing it to you because the story I just told you is in the book, together with a lot of other stories. So it's a memoir. So I hope you buy it. Look, I'm doing this, I might as well plug my book. But I want to talk now about younger disabled people. Some of them are put on Medicaid by their parents when they're children. They know no other way. For them, being on Medicaid is the norm. They accept having to keep their income low enough. Recently, I came across one of these, what do you call them, those podcasts, a podcast. And there was some very bright young disabled people. They were talking about the ABLE savings account, which is a way of allowing some disabled people to have some money and remain eligible for the means tested program, especially for Medicaid. They also mentioned other ways, such as special needs trusts, which put control of funds in the hands of a trustee, and Medicaid for people who work, which is good, but however, it puts a cap to the amount you can earn. Nowhere during this conversation, the question come up of why? Why do we have to do these financial acrobatics in order to keep getting the vital services that we need? Why are we not allowed to earn whatever money we're able to earn? Why can't we put our money in the bank like everybody else? Shouldn't the services we need be ours by right? The oppression, you see, is so deep so deep-rooted that it is not recognized as such. I want to also note that rather than fighting to change this unjust system, the disability community and those who represent them, whose interests at times may be conflicted since they're profiting by Medicaid remaining just the way it is, have put their efforts into finding ways to get around the system in order to make the injustice somewhat bearable, rather than changing the system, which is what we need to do. And you cannot blame disabled people. Those who need that type of assistance are grateful to get it from Medicaid, because without those services and supports, they would not have a life. So they're afraid to rock the boat. And one thing that I want to note is that in the U.S., when it comes to getting services under the Medicaid program, there are huge differences between states. There are good states and there are bad states, and New York State is one of the good states, maybe the best states, best state. New York has always had one of the most generous Medicaid programs in the country, and that's because we've had a community that has done a lot of fighting, and also some good legislators that have listened to us. And I actually know people, and I have even helped people move from other states to New York so that they could get the services that they needed. Right now, and I want to say this right now, however, our governor seems set on making cuts to the Medicaid services, and one program in particular, and it's important to me because that's the program that my husband used all the years that he was on Medicaid. That's the Consumer-Directed Personal Assistance Program. And that's being threatened. That program allows you to hire, train, and if necessary, fire your workers. It actually saves the state money, so I don't understand why they're trying they're attacking it. Cuomo plans to cut $150 million from that particular program. And I said because my husband, it's important to me because my husband used it, but also because this is a program that started in New York City, and we had consumer-directed personal assistance this personal assistance program before any other states. It started in New York City in 1980. So please, call Cuomo's office and the Department of Health and your elected officials, your legislators, and let's stop those cuts. I've always found it difficult to get people with all types of disabilities, but especially people receiving home-based services through Medicaid, to come out and support single payer. Why is that? They're afraid. They're afraid things will be worse for them. They're afraid, like I said before, they're afraid to rock the boat. So I want to talk to my fellow single payer advocates, and what do we need to do to try and get disabled people to fight for a single payer system, to understand how much better off they would be with a single payer system. First of all, we can now assure them that long-term care or long-term services and supports are fully covered by the single payer bills we have. We put up a long fight to get long-term care included into our state bill, the New York Health Act. My husband and I pestered our assembly member, Dick Godfrey, for years. Well, long-term services and supports are included in the New York Health Act. Yay. And I thank PNHP, and I thank the caring majority for the help, the great help in winning the fight. Now, Bernie Sanders' bill, the federal bill that's now in the Senate, did not at first include long-term care, but it does now. And the old House bill, H.R. 676, of course, always did, and so does the new House bill. It includes long-term care. So single-payer advocates can assure disabled people and seniors that under single payer they would no longer have to impoverish themselves in order to get the services that they need. So, number one, if we win this fight, I should say when we win this fight, well, in New York State, we're close, we gotta do it. People must continue to get whatever long-term services and supports they are getting through Medicaid now. Things should not get worse, they should get better. So that's the first thing. We have to assure people that they're not going to lose any hours. They're always afraid of that. That the only difference will be that they will no longer need to prove that they're poor and qualify for Medicaid. That those services are going to be theirs by right under a single payer system. And then we must, of course, work so that the same services are available throughout the country. Well, that's if we get single payer, the federal, if the federal single payer bills get passed, you never know what's going to happen next year. I don't know. I want to be optimistic. It's difficult listening to the Democrats proposing plans that are not single payer plans. We don't want to make the same mistake and start supporting those who talk about public option. We have to fight for a true single payer system. What was I saying? That we have to. It would be good if we could get the federal bill passed. I'd like to see New York be first, though. I'd like to see New York be first. But yes, the services should be the same in the country. There shouldn't be such a big difference between states, and also we must do everything we can to improve the services, and to make sure that home health aides and personal care assistants are paid well for the important work that they do, because now they're not getting paid well enough, not at all. Okay, and that's the first thing I wanted to mention. The second thing, number 2, you heard adapt our homes, not nursing homes. We want to be able to receive all the services and supports that we need, all the care that we need in our own homes, and not be institutionalized. I mentioned ADAPT in 1990. That was right after the passage of the Americans with Disabilities Act. That's when ADAPT started fighting to free people from nursing homes and other institutions. And at the time, there were people, and there still are, I'm sure, there were people who were institutionalized as children and spend their whole life in a nursing home or in an institution. We say, people that are serving a life sentence for the crime of having a disability. I want to say something, though. In New York City, we already had, when ADAPT started fighting to free people from nursing homes and to try and get a program of personal assistance services and supports established throughout the country. I must say, in New York, we already had it. In New York, we had quadriplegics living in their homes, getting 24 hours of services. So New York City was first in everything. So that's why I really want New York City to be first in getting a single-payer system. New York, help! Okay. Again, we've been first because we've had good activists. And we've had some, not all, but some good legislators listening to us. By the way, when we started, and this is something I'm very ashamed of, especially now that I am a senior myself. Back then, we were mainly concerned about young people who were in institutions. In fact, we talked about how many people under such an age were in nursing homes, and as if it was okay for people after they live a whole life to go and die in a nursing home. I apologize to my fellow senior citizens. Nobody should be institutionalized against their will. I understand there are some people that may prefer to be in a nursing home. I don't know any that do, but you should have, that should be your choice. And we want to make sure that people are never institutionalized against their will. And by the way, one thing is that it's amazing how things have turned around since 1990, because now most people agree that remaining in your own home is the way to go. Today we talk about aging at home, aging in place, aging at home. That's the preferred way. And it is very important for seniors and for younger people with disabilities to work together towards that goal. I want to mention, since we're talking about institutionalization, I want to mention a federal bill the Disability Integration Act. It's a bipartisan bill. It was introduced in the Senate by our Senator Chuck Schumer, and in the House by Republican Representative Sensenbrenner. I always have trouble pronouncing his name, Sensenbrenner. Adapters always tried to have these bills be bipartisan. It ensures that people who need long-term services and supports are not going to be institutionalized against their will. So let's help us get that bill passed. I spoke at the Disability Pride March recently, just a couple of weeks ago. I was made Grand Marshal this year. I don't know who decided that, but I spoke of our struggle and the struggle of all unwanted people being one and the same. At the speech I made at the Pride Parade, the Disability Pride, I said it was Bastille Day that day. Yes, it was the 14th of July, and I said, let's tear down the walls. We want no walls keeping people out, and no walls keeping people in. And the last thing I want to say, talking to single-payer advocates who are trying to get disabled people to come out and support the single-payer program, our motto, the motto of our movement, has been since day one: nothing about us without us. I have this little anecdote. I always I tell people when the movement started, which was the disability rights movement about half a century ago. We had no control over our lives. We had no choices, especially those of us who had significant disabilities. At the time, there were organizations for disabled people. They were not run by disabled people. They were run by non-disabled people, and they were for the poor, unfortunate, disabled. Actually, the word they used then was handicapped back then, and that's a term that we rejected because it suggested the cap in hand, the beggar. So the little anecdote, I was getting away with it. When the board of a certain organization was told that the handicapped, as we would call them, wanted a say, wanted some control, or even wanted to sit on the board, you know what the response was? Well, that's like having cats and dogs sitting on the board of the ASPCA. That's how bad things were for us. And at the time also we had disability-specific organizations. If there were any organizations, if the disabled people had any say in any of the organizations, they were all disability-specific organizations. And I want to mention another first for New York City. Do you know where the first disability rights organization that was cross-disability, it was for people with all types of disability, where it started? Right here in New York City. That organization is called Disabled in Action, and it was founded in 1970 by Judy Heumann, and it is very active still today. So we have to make sure that if the single payer becomes a reality, we have the people who need who use the healthcare and the services and supports be right there at the table, not those that represent us. That's very important for everyone, but especially for people with all types of disabilities. So we want to make sure we assure when single-payer advocates talk to people with disabilities, make sure that that's made clear, that yes, we will have a seat at the table. Yes, we will have a voice. And at this point, I would want to people to ask me questions and to answer questions. Unfortunately, this was supposed to be a webinar, but it didn't work out that day because nobody could hear me, and we never figured out why that was, but they couldn't hear me. So I did this video instead of the webinar, and I encourage everyone to ask questions. You can use the comments section, under the video to ask questions, and I will be more than happy. I will check. I will make sure that I keep checking, and I'll be more than happy to answer your questions. And I'm going to show my book again. Look, let me do this. This is my book. Such a pretty girl. That such a pretty girl is what I heard growing up, but it wasn't. It was never said. It wasn't said such a pretty girl. No, it was such a pretty girl. What a shame. It was my mother carrying me. I had polio, couldn't walk, and my mother would be carrying me, and that's what I heard. What a shame, what a shame. That refrain followed me around as I was growing up, and then even later on. So that's where the title comes from. I managed to live a very rich life that was full of purpose, and I talk about my life in this book, and I try to expose the ableism that it's ingrained in our society and in our social economic system. I mean, because the stereotype is that the disabled person is poor, so all the programs for disabled people are based on they're means tested, and because disabled people are not thought of wanting to be married, there are many disincentives to getting married and to working, because they thought, well, disabled people don't really work, because if they're disabled, how can they work? But we certainly can. That's it. Please ask me questions. I'd be very happy to answer. Thank you.